everybody, welcome back to our podcast, Voice of Care, Caring from the Heart. So for today's topic, we'll be talking about a topic which often sparks a lot of curiosity regarding women. So when you think about plastic surgery, what do you usually think? Breast augmentation, right? So in order to tackle more on this topic, why do people do it, how to prepare for it, and also to understand an overall understanding of it, let's welcome our esteemed plastic surgeon from Mandai Hospital Ipoh, Dr. Khoo Yan Teng. Doctor, do you want to introduce yourself to the audience?
Okay. Hello, everyone. Good morning, Sherly. And then thank you for inviting me for this podcast. I'm Dr. Khoo Yan Teng, a plastic surgeon of experience of 19 years, helping all the women to enhance themselves and to know about themselves what they want. Especially for modern women, they know exactly what they really want. Just like I provide some guidance, to help them. And this topic is very interesting because it's a women, they were curious about what is breast augmentation. And they have a lot of myths or a lot of doubts, they want to clear. And this will be the right episode that we're going to clear the doubts and give them the facts with a very clear and honest answer.
Alright, so for the audience, remember to stay geared up and listen to what our questions have to say. So what exactly is breast augmentation, doctor?
Okay, Sherly, for breast augmentation, most of the time the women will come to me, basically they want to enhance, their beauty, by giving a fullness to the breast or the shape or maybe increase the size. And besides that, and most of the time, they want to restore the volume of the breast, especially after the breastfeeding, post-pregnancy, or sometimes lately there are quite a lot of cases of massive weight loss and they're losing a lot of breast volume. So there's another way that actually we can reconstruct, increase the breast volume. Besides that, I do treat a lot of breast cancer patients, collaborate with my breast surgeon, and after they remove the breast cancer part, and of course, as you can imagine, there will be like one flat chest, and then so my role is to rebuild the breast for those ladies and to enhance, increase their confidence for that. I think my role as a plastic surgeon is to guide them, provide them options, what are the good things or how to make their lifestyle, enhance their quality of life. Yes.
So plastic surgery, specifically for breast augmentation, so it's more about giving the patients what they feel much more comfortable, and also it's not only for cosmetics, right? It can also be for reconstructive. Like what you say, for example, after having breast cancer and they went through major surgery and all.
Yes, very true.
And then for patients that come in, right, do they usually do they know what they already want when it comes to having their breast augmented?
Yeah, very interesting. Most of the ladies, some of them, they will know, they will show me the reference, they know what size they want, and how they want to carry themselves. But quite a number of these ladies, they have no idea. They just tell me that, say, oh, I want a bigger size, or I want something natural that no one can tell that you have something done before, you see. So that's my role, is to provide them all the correct technique to make a proportionate posture based on the shape, the body frame, and then they can see what they want. But ultimately, the main objective is to get their expectation to achieve in a reality, the size, to improve the quality of life. Yes.
Then usually for that, right, how do you guide them throughout the many different types of breast implants, for example?
In the modern days, most of the time, because for the breast implant is quite established worldwide and it is very safe, and you have a very latest technology, to build the safe implants which can last quite many years. For the time being, for breast augmentations, breast implant is one of the best options. Of course, there are other alternative, but all the ladies, breast filler is not a recognized type for the breast augmentation. So you can see nowadays, I do see a lot of ladies, maybe for financial status and because of non-invasive surgery, they will go to the non-board certified personnel, or maybe not even the doctors or beautician,
quite dangerous
to get the breast injection to enhance the cells. But most of the time they come up with a lot of complications that most can't imagine of. Correct.
Then for that cases, right, so what's the difference between the breast filler and breast implants, like what we have over here?
Oh, right. As I mentioned just now, breast implant, you can see is currently the latest technology is what we call this silicone breast implant. So you can see the texture is very soft, it is clear. By increasing the size, we can choose what size we want, and we can choose the shape as well, and then the fullness and the projection, everything. But of course, all these things is very technical. We must base on the frame, the body frame of the lady, or whether whether they have any asymmetry of the breast, that's the time that actually we will guide them, which is the suitable for them. And of course, based on the body mass index as well, everything. And regarding for the breast filler is definitely, it's not a recognized treatment for breast augmentation. But yes, there are a lot of people using this breast filler by those like unrecognized, unlicensed personnel. And because it's quick, it's just by injection, and then you can fill in whatever all the filler in it. And most of all this filler, because it's not licensed, it's not it never been through all the medical research and the development. So you don't know how safe it is, and moreover, how they get the source of this filler, you're not sure where it is, and whether it's safe to use on the human body. Also, there's a query part about that. So a lot of ladies, especially young ladies, they come to me because they want to keep it as
natural.
Some very shy about that, and she can't reveal it to anyone. She want to keep it herself, so just get the injection. And most of all these things are bio not degradable things. They will be in the body for a long time, and most of because foreign bodies, it will easily cause infection. When the breast start to have infection, you can see a lot of pus, discharge, and out of shape. There are a lot of things, not only physically, mentally, psychologically. So it's quite a big stress for them.
Some more, it's quite a major thing as well for their self-esteem, right? Having something in their body. And then coming back to this topic, right? Then what are the common misconceptions about breast augmentation surgery that you wish people can stop believing?
Okay. First thing that they will say, I want the biggest.
Biggest not always better.
Correct. Biggest is just the size, but we must guide them through the expectation. What to match with the reality, which is the more suitable, because we want them to look natural. And then because oversized of implants also is not good, because if oversized, not only it cause disproportionate, and it will cause a backache because it's too heavy. Too heavy, you end up with all the bra strap, painful strap, everything. And then not only that, because can you imagine something, a balloon, you overstretch it, and then with a lot of stretch marks over the breast. Most time they feel very heavy, especially it will disturb their lifestyle. For example, if they go for sports, and then when they put on the clothing, it will be so disproportionate. So some oversized or bigger size might not be suitable for everyone. Unless they know what they want actually.
And then coming back to that, right, when people usually come for breast augmentation, is it always they want their breast to look much more bigger or even smaller? Like how's the cases?
Another myth of that also, they think that for the breast augmentation actually can solve the sagging problem. For mild sagging, yes, breast implant actually can enhance it and make it look unnatural. But sometimes very significant ptosis or a droopiness of the breast, this breast augmentation have to combine with another form of surgery. We call it breast lifting surgery.
Like
at the same time, yes, to remove excess skin so that the breast can contain a better shape of the implant.
So breast augmentation, it can be for making the breast slightly bigger, even smaller also can, because some ladies they have back pain due to the breast size being too big also, right?
Correct.
Do you also encounter this kind of cases?
Yes, we have a lot of ladies in Malaysia. So what they see is like they have a very small frame, but they have oversized breasts since young. Sometimes over time, there's a droopiness, it's causing heaviness, and especially they have the pain, causing the back pain. And of course, when they will reduce their exercise activities all this because they feel very embarrassed of having a huge breast during correct. So this is a time that actually we help them to call it breast reduction. So to reduce it to the more optimal shape, so to improve the quality of life. Besides that, I think another myth also, you will say, breast implant, will it cause breast cancer? Have you heard about that? Yes, it's very common. In reality, for breast implant itself, it won't increase the risk of a breast cancer. But even though it won't cause a breast cancer, but I will advise all the ladies, we have to, above 40 years old, we have to do a screening for your breast, a self-examination. All this is very important, whether you go for the breast augmentation surgery or not.
So even with the breast implant, we can also still do the breast self-test by ourselves, is it?
Oh, definitely. You still can check, and then you still can go through, all those radiological assessment. For example, you can go for the ultrasound of the breast, breast, and or maybe there's a specific type of mammogram also, it is totally no problem. And some women might be asking is, after the breast implant, can I still breastfeeding, or can I still get pregnant or
because
not?
people will think whether that thing will block the milk.
Correct. It won't disturb it at all. Most of the ladies after a breast augmentation, they still can pregnant, they still can breastfeed. Actually, whatever the breast structures are still the same. We're just increasing breast size with implant. So the sensation, the most of the sensation with a good technique, the sensation on the nipple,
it's still the same,
and everything is there.
I see. Okay. And then one thing about having breast surgery is also when you're having those implants, right? What if, let's say, halfway they suddenly change their decision whether they want to make it bigger, smaller, or remove it? Is it possible also?
For the breast implant, it's totally reversible. So first of all, you must make transparent to all the ladies who come for that. For example, they're not satisfied with the size, you can remove it and you can exchange it as well. Completely no issue at all. Or maybe now you enjoy the benefit of a breast implant with this size. Maybe like 20 years down the road, and when we age, our skin also will get sagging. Maybe the implant is still very nice right there, but the skin is a little bit lax or something like that. Or so most time they'll say, okay, they don't really like it, and then they want to exchange, we will based on the structures, and then either we'll do some breast lifting, combine with a change of implant or anything. There are a lot of techniques actually can solve your problem. Quite common nowadays, modern women, they will have a different lifestyle, partners, all those things, sometimes you might consider the partner's opinion as well. And some partners will say, okay, I want a bigger size, so they might change, increase to the implant size also. This is to suit their lifestyle.
See, quite interesting for breast augmentation. There's quite a lot of misconceptions about it, but luckily you have doctor to help bust some of them lah. Okay. And then considering like we already know what are the benefits for the patients and all, then can doctor maybe share some story about that? For example, this patient, they went to the clinic having their breast augmented, then how was the overall impact towards their life?
After the breast augmentations, actually psychologically impact is very huge, because they will boost up their confidence so much, and they feel so different, and sometimes might just change your life. Which is true. Even from someone which is very shy, and then they're no confident at all, they can be a very good confidence level for them. And not only that, psychologically they improve their sexual confidence as well. And then besides psychologically, for social also, and they feel more confident with their clothing and with their partners, and then with their the sports, all those things also. They feel very, very good. And then of course for the physically, unless we want to achieve a symmetry of the breast, maybe those ladies will have asymmetry of the breast since young, or maybe due to the trauma, or maybe due to the breast cancer removal, that physically it can impact very much.
Having them much more happier with the overall life.
Correct. But overall, we are here is to help them to improve their quality of life.
The most important thing is do it for yourself and also for your overall health, right?
Correct.
And then going into that topic, so what advice would you give to the women out there who are considering about breast augmentation surgery? Because it's quite major surgery, and people wondering about any doubts, and if I do this, what will happen to myself, like all of those lah. So what advice would you give to them?
First and foremost, I think it's very important, you must choose your doctor. You must get the board certified plastic surgeons or the breast surgeons who are well versed in this field, because they have the knowledge, the latest information, to match what you want. And then after you got the board certified surgeons, then you talk about all the techniques, based on what size you want, what's the expectation, what projection you want, and how comfortable or how natural you want it to be. Besides that, and then we will, for those patients who are really not very comfortable, they're anxious, we are there for you, to clear your doubts, all those things, and then we will be transparent to you and be more reassuring to them. And then so what are the things, do's and don'ts after the surgery or before the surgery. And because I think that pre-operative assessment is very important, we must make sure that they're fit for the surgery, and then after the surgery, what are the things that we're going to expect, and so they can minimize all the maybe
anxiety from not knowing.
Correct. This is very, very important. And I think that maybe those ladies have doubt, not very certain and very anxious, and then we must show our empathy to them, put ourselves in their shoes, and to know what actually they want and what's the concerns, so we'll clear or normalize the anxiety, everything. And if they do still have doubts, no problem, they can make multiple consultations until they feel very comfortable, because there's no pressure at all. As you mentioned, it's a major decision. You must be confident with your surgeon or whoever that you're going to proceed for the treatment. This is very important, because I do think that we have the role, not only just finish the surgery, we need to be there for you whenever after you have encountered any problems. We'll be there to solve the problem for you.
Then to circle back on this topic, so if let's say this patient decided to undergo this surgery, so what can they expect after that surgery? Like, how's the recovery process is like? What are the things that people may commonly see after the surgery, and like how to fix it like that?
In my experience, most of the ladies come, most of the time, according to my technique, they will feel a bit discomfort over the muscle area.
Initially lah.
Correct. And for maybe first one day, and the second day you feel quite comfortable already, because we'll do a lot of all this after surgery care, and the garment, the protective brow, those things, to reduce the pain, and at the same time to reduce the swelling and to maintain the shape. We'll guide them how to take care, and then when we can get back to work, and when they can start with the sexual activities with a partner. So these are the concerns of the modern ladies nowadays.
And do they have to wear like a bandage after the surgery, or just that supportive bra to help?
For my practice, I think a good supportive medical bra is good enough. Because it depends on the surgical technique, how you're going to place it. You don't oversize it, and then create just a very nice pocket to incorporate implant. That should be good enough. After that, maybe we will schedule a very frequent follow-up with the ladies, to help them to minimize anxiety, to reassure them. After that, I think this is very important. After that, give them our contact. If you do have any doubt, any unsure, whatever, they can contact us for that.
So they can expect maybe like after a few days, and they can go into their normal life routine already.
Most of the time they can. They are very good on that. They can adapt very well. The last patient came to me for that at her mid-30s, and she just got married, and then husband is very supportive, never pregnant before. She's very happy. She said I should have done it 10 years ago.
Because currently we have much more consultations, also a lot of information online as well, but be careful of information online as well. Need to make an informed decision.
Correct. Because all the sizes, everything, you need to have a guidance, to custom made or tailor made to individual, the preference, all those things. Because as I mentioned, the bigger size is not necessarily the best, the breast augmentation at all. Not too drastic.
Okay. So to summarize, because we're almost at the end of our podcast, so for breast augmentation surgery, it's not only for a cosmetic procedure, but also for the overall well-being. Because sometimes a major trauma happen in our life that we would require some augmentation and also a little bit of reconstructions also, right?
True, very true. So if you do have any doubts, or now I believe that this episode we have cleared a lot of myths, and then give a lot of facts, and then we'll give a very honest answer based on my experience. And if you do have any questions or whatever, you can put out the question, and then we will answer you. Any interesting topics that you want to discuss, we can talk in detail about that as well.
Definitely. So if you have any doubts or any questions, you guys can leave a comment. And not only that, be sure to follow us on all of our social media platforms. We have on YouTube, Facebook, Instagram, Twitter, TikTok as well. So make sure to follow us on all our social media platforms so that you can get the latest update, and stay tuned for more episodes like this. So once again, thank you, Dr. Khoo.
Okay, thank you, Sherly, for having me.
Alright, it's a pleasure. Bye-bye.
Okay, bye.